Good morning, everyone. My name is Senator Dr. Desiree Murray. I'm the chairman of the Joint Select Committee on Social Services and Public Administration. We are here today for this first public hearing pursuant to an inquiry into the state's response to student underperformance in primary and secondary schools, the adequacy of the Student Support Services Division, and its impact on school dropouts at the primary and secondary school levels. This is the first public hearing by any joint select committee for the 13th Parliament of the Republic of Trinidad and Tobago. Now, due to the dissolution of the 12th Parliament on March 18, 2025, the committee regrets that they were unable to conclude the deliberations and report on this matter. However, given that improving our education system is of critical importance for several reasons, the newly established committee, of which I'm chair, agreed to resume and complete this inquiry. So I want to say a special thank you to the representatives from the Ministry of Health, of Education, I beg your pardon, for agreeing to reappear once again. Members of the public are invited to submit their comments on the Parliament's social media platforms, YouTube channel ParlView, or via Facebook and X, formerly known as Twitter. You can also follow us on Instagram and Facebook at TT Parl Committees for real-time updates and highlights from committee meetings. I would now like to ask the representatives from the Ministry of Education to please introduce yourselves.
Thank you, Chair. Good morning. Claudel McKellar, Permanent Secretary, Ministry of Education.
Good morning. Peter Smith, Chief Education Officer.
Good morning. Dr. Nurse-Carrington, Manager of Student Support Services Division.
Good morning. Kamini Bagalu, Director Acting of the Division of Educational Research and Evaluation.
Good morning. Michelle Carter, Acting Director of School Supervision.
Good morning. Anna Singh, Director of the Division of Curriculum Planning and Development.
Thank you very much for those introductions. I'd now like to invite the committee members to please introduce yourselves.
Good morning, Symon de Nobriga, Member.
Good morning, Melanie Roberts-Radgman, Senator.
Good morning, Ravi Ratiram, Member.
Thank you. I will now state the objectives of the inquiry. We have 4 objectives. The first is to assess the current performance levels at key examination checkpoints, including SEA, CSEC, and CAPE. The second is to examine the rates of truancy and school dropouts at the primary and secondary school levels over the past decade. The third objective is to evaluate the capacity and effectiveness of the Student Support Services Division in providing adequate support and interventions for students. And the fourth objective is to review and analyze the effectiveness of current strategies aimed at addressing underperformance, truancy, and school dropouts at the primary and secondary levels. May I invite brief opening remarks from Mr. McKellar, Permanent Secretary, Ministry of Education. And could you please restrict your remarks to 2 minutes? Thank you.
Thank you, Chair. Madam Chair, members of the Joint Select Committee on Social Services and Public Administration, and members of the viewing public, good morning. On behalf of the Ministry of Education, we thank you for the opportunity to contribute to this crucial inquiry into the state's response to underperformance in primary and secondary schools, the adequacy of the Student Support Services Division, and the broader implication for school dropouts. The ministry is represented here today by a dedicated and professional team of senior technical officials who bring a wealth of expertise and a shared commitment to advancing educational outcomes for all students in Trinidad and Tobago. The team members would have introduced themselves before. The ministry is acutely aware of the challenges that confront our education system, including disparities in school performance and instances of student absenteeism, which can impact dropout rates, and the increasing demand for comprehensive support systems. These challenges, however, are not insurmountable, and we remain committed to addressing them in alignment with the goals of the Strategic National Development Plan for 2025 to 2030 to deliver impact, value, and benefit the citizens of Trinidad and Tobago. Fundamental actions must be performed if education systems intend to support every child and achieve equity, access, and quality. As part of the ministry's policy framework, Pillar 1, preparation of all children to maximize education opportunities. Pillar 2, preparation of parents and guardians to assist children to maximize education opportunities. And Pillar 3, transformational initiatives to improve the education systems. Initiatives such as universal screening of children and re-engineering of the Student Support Services Division to become the primary, the primary operation for screening and treatment of all children underscore our dedication to student achievement. The development of standardized parental training programs and the provision of tablets and laptops will enable the required support system for students. Madam Chair, the ministry is committed to continuing its engagement with this committee and all relevant stakeholders to ensure that every child has the opportunity to succeed regardless of their circumstances. We firmly believe that education is the foundation of national development, and we are prepared to share our insights, challenges, and proposed solutions in dealing with today's hearing. We thank the committee for its continued commitment to improving the education sector and look forward to engaging in meaningful dialogue that will support the ministry's ongoing efforts to build an education system where every child is supported and every child can learn. Thank you.
Thank you, Mr. McKellar. Before we begin, I would just like to remind committee members and officials to direct your questions and concerns through the chair, and also to kindly activate your microphone by pressing the microphone on and off button when you are acknowledged by the chair, and then please turn it off when you've concluded your contribution. Okay, we'll now proceed with the hearing. I will begin by trying to address Objective 1, which is to assess the current performance levels at key examination checkpoints, including SEA, CSEC, and CAPE. The ministry's written submission mentioned that the northeastern Port of Spain and environs and southeastern education districts consistently recorded higher numbers of low-performing students during 2020 to 2025. This is on page 3, question 1. My question is, given the consistent underperformance observed in these districts between 2020 and 25, what evidence is available regarding the impact of previously implemented ministry interventions on student outcomes?
Chair, through you, I'd like to direct that question to our Director of Curriculum Development, Ms. Singh.
Good morning again. While we have noted that of the 8 educational districts, these districts in comparison perform less than the others or poorly, what I'd like to draw your attention to is that there have been improvements over time for these districts. So relative to the 8 districts, they have, if you rank them, their performance are lower. But in terms of over time, their performances have improved. Slight dips here and there. So I would say that we have noted our efforts in terms of assessment training, in terms of our targeted monitoring of the schools, particularly in the areas of planning, pedagogy, and assessment. Our focus on strengthening our school leadership, particularly heads of department, and understanding the requirements of school-based assessment. Those have given rewards in terms of slight improvements. I would want to also draw to your attention, however, that these districts largely have populations of either rural schools or high-risk, so to speak, schools, marginalized areas. So the problems are not only pertaining to teachers' delivery or institutional strengthening, but the problem extends beyond to the socioeconomics of the parents, to the community issues, so that our efforts have been ongoing. We have attempted and have done interventions, but we do recognize, and as they say, the school is a microcosm of the society, we do have particular problems that remain a challenge.
Thank you. So my question really is, what evidence is there that there has been improvement, that the resources that have been expended are bearing fruit? Because from what I see here, the average annual decrease in the students who score 30% or below is only 0.006%. That's the average, and some of these schools are even lower than that. So is there any evidence that the programs are having any impact on performance?
I would have pointed, so we did report data on academic performance for these districts, by districts, and those data speak to slight improvements, as I've indicated. Yes, slight in terms of would-be improvements over time. That is not beyond 10% or that, but it is steady improvements. I can refer you to district data, district performance on page 5. District performance, yes?
Yes, I see that. So my question is, what was the initial target? I mean, you must have had objectives at the start that were specific, measurable, achievable, and time-bound. And are you meeting those targets when you say slight improvement?
Right. So in terms of our criteria for assessing underperformance or below the expectations of optimal performance, we look at the SEA level in terms of number of students who have scored under 50% more recently or under 30% in previous times. We also look at the CSEC level, numbers of students who have scored, who have gained 5 passes in general or 5 passes with math and English. What we have found is that the gatekeeper subject at both levels are the mathematics, and we have worked over time and we've reported the initiatives we have done to strengthen mathematics, to strengthen our teachers, to provide support to our students, and more recently, to provide support to parents. You're asking what metric we are using in terms of the projected improvement, and I would say that generally that metric is around 5% annually improvement, and as indicated, we have seen in the last year in some districts a 5% roughly, so that has been achievable. the reason why the metric for these districts would be such a small margin, as indicated, there are so many uncontrollable factors beyond the scope of the institution in terms of being able to intervene.
So I understand that, which I would like to commend the ministry on collaborating with many of the other ministries to address those issues. But at the end of the day, we want measurable results. So that 5% was a predetermined target, 5% with each year, and so you would say you're meeting target?
I would say that for these districts, the 5% seemed to have been what was a potentially useful target to pursue. In general, the national target wouldn't be 5%. I would say that the national target would be closer to 10%. But for these districts where you see chronic underperformance, it was more reasonable to project for something that we could have managed. And as indicated on page 5, we met it for some, and for some we did not. But it is always the intention to project going forward based on the context, because it does vary at the school context what is possible in terms of what can be pursued and how we tier our interventions and how, in the interest of equity, the resources are deployed.
Thank you. The submission also mentions the gender gap in performance, and it's most pronounced in language-based subjects such as English language arts. Are there any proposed interventions aimed at improving male performance in language-based subjects given the observed gender gaps?
Chair, through you, Dr. Smith, Chief Education Officer, will respond.
Thank you very much. Chair, in terms of the male underperformance, underachievement, one of the things that we have noted in disaggregating the data is that it's more pronounced, let's say at SE, for students scoring 50% and under. Above 50%, more or less, we have no real significant difference between the boys and girls. It exists at the lower level, as I said, less than 50%. It has been an area of considerable research, and one of the things that we would have done as a ministry, we would have acquired the services of one of our tertiary institutions, and they would have provided extensive training as well as documentation for us in the use of, for instance, differentiated instruction to really help to address this matter that we currently see in students scoring 50% and less, especially in our SEA.
So are you saying that they're going to be using the data to adjust the curriculum based on boys or girls?
Yes, Chair, that is definitely the intention. Because what it allows us to do, when we look at the data, going back to it, it points us to 3 different categories. You have the less than 50%, where we see the major difference. We have 50 to 70%, and then we have above that. And what the ministry's intention is, and what we are currently doing, is trying to adjust those strategies to address the first 2 bands, less than 50% and 50% to 70%, by using different strategies, especially for some of our boys. It must be said, though, that although we look at male underachievement, we also have a certain percentage of girls who also underperform. So as we focus on the boys, we also need to do that focus on some of our girls.
Can you elaborate on any of those interventions for us that have been successful?
I think if we, for instance, some of the results are pretty early, Chair, and normally what happens after our exams are administered, we will do additional research. So at this point in time, that disaggregated data as well as the actual impact may not be available because we are still in the process of doing some of that data research.
Thanks, I understand that, but could you give any examples of interventions that have actually been implemented that you think may address the issue of the gender gap?
Right. So, for instance, with the mathematics especially, what we would have done, we would have, working together with one of our tertiary level providers, we'd have developed very extensive manuals in reading, comprehension, as well as mathematics. And the approach that was taken is that instead of just treating all our students as one, we are saying in any one class, we may have 2 or 3 different levels of performance. And so lessons will develop to cater for those differences. Again, that would have been informed by differentiated instruction. And if I may, the philosophy of differentiated instruction is one that is student-centered. We're looking at proactive learning, flexible grouping, ongoing assessment, respectful tasks, especially for boys, because there are some boys or some males who have challenges with the types of tasks that are administered to them, adjustment of the content, which is very important. So we actually have the adapted curriculum that our curriculum department would have developed and published, high expectations, building on readiness, student voice and choice, teacher-student collaboration, multiple pathways for mastery, and a growth mindset. In other words, we are encouraging our students, our boys, as well as our girls, to not be daunted when they make mistakes, but to really persevere. So this philosophy has been built into those 11 training manuals, which span Standard 3 to Form 1, Form 2 at the secondary level. Training has taken place, and we are in the process of analyzing the impact of the use of those materials.
Thank you, because you had mentioned individualized educational plans for students, so that has been implemented, because these are general terms and philosophies, but are there any specifics? And for example, if I were to ask you to trace a child who's underperforming in, say, primary 3, who's been identified, and these interventions have been implemented for that child, what is the likelihood of that child going on to score over 50% and then getting 5 passes at CXC and graduating, as opposed to becoming a truant or a dropout from the system?
Okay, so at the primary to secondary school level, we actually have in our possession and have been using for the last few years what we refer to as a value-added methodology. So it actually allows us, Chair, to track students who have written SCA in any particular year, and then 5 years later, we are actually able to track that student to see if he or she would have achieved 5 or more passes at the CSEC level. It's a fairly new report that we have. So that information I can supply to you in writing. If that is okay with you, Chair.
Yes, thank you. Just one final question before I pass over to the other committee member. Which tertiary level institutions were actually engaged by the ministry for this exercise?
The University of Trinidad and Tobago, UTT.
Thank you. I'll hand over now to Mr. de Nobriga.
Thank you very much, Chair. Chair, before I go on, if I could just add one question to your initial questions. So through you, Chair. On page 3, under the heading of national performance, specifically at SEA level, one of the submissions speaks to a slight decrease from 59% in 2024 to 56.2% in English language arts writing. And Dr. Smith, you did speak briefly about that. My question is really from the ministry, are we seeing a downward trend in terms of our passes or our pass percentage in English language arts writing, and is there any anecdotal position you can take as to what is contributing to that?
Okay. So, Chair, generally the performance at the English language arts writing fluctuates. It fluctuates generally by a point or two. When it's converted to a percent, it looks a little higher. In terms of the performance and the patterns, as I said, it fluctuates from year to year. So it increases one year, drops the other year. In terms of anecdotal reports, writing is the most complex of the tasks at SCA. It's one of those areas sometimes that students are not comfortable with. Admittedly, sometimes teachers may not always be comfortable with it. And so what the ministry has done, we, working through the curriculum department, have developed a handbook which provides schools with samples of good work, as well as extensive workshops designed to lift the standard of performance. But generally, what we have seen over the years is that fluctuation by a 1 point or 2 points.
So, Chair, if you don't mind, I know year to year there may be a fluctuation, but if you look at it over, let's say, a 10-year duration, you may be able to see a trend. Is that trend fairly steady, or is it downward?
Ms. Kamini Bagalu, our Director, Education Research.
Okay, good morning. So if we were to look at the trend over the last 5 years, we would have seen that it has remained fairly steady. There were some fluctuations, but in 2025 to 2020, we have seen that the performance is quite similar, with 57 as the mean in 2020, and in 2025, the mean is 56.2. So we have seen that it has remained fairly steady.
I appreciate the answer, Ms. Bagalu. Chair, the reason I ask is because, of course, even as society drives itself further and further to technology, there must be some balance that is kept in order to ensure that we don't lose those writing skills. So I do appreciate that there is some stability in that. Chair, that brings me to my questions, and my questions are specific to your submissions at page 8 of your submission, and in answer to question 2. And question 2 would have asked, what specific intervention strategies are being applied to address the low pass rate in mathematics, specifically at CSEC? And of course, we looked at 45.89% in 2025. The Ministry of Education's submission stated that the provision of technology-based learning materials and gave examples, specifically speaking to one example here, which was the use of an AI avatar to answer students' questions, key concepts and content aligned with the Form 1 mathematics curriculum. So, PS, through you, Chair, my first question is, obviously, is the AI avatar available to all Form 1 students now?
Chair, I think I can respond to that. As part of the ministry's policy going forward, the government had committed to providing all students entering Form 1 from this current academic year, 2025-2026, with laptops. The intention is to have those applications loaded onto the machines so that the AI avatar-enabled learning materials can be used.
So, PS, just to drill down a little bit, that would be when students obviously have the laptops. Right. We know that I think an announcement was made that by the end of November, those laptops will be available. So, if we take the position that as of today's date, the laptops may not be, I mean, if you want to specify that, may not be in their possession, is the AI avatar accessible at present by all Form 1 students?
No, the avatar and learning material is not available at this time. We are in the process of development of the materials.
Fair enough. So further to that, is there going to be a mechanism for the ministry to reach an impact on the AI avatar's intervention on students' mathematics preparation? So will you be able to monitor the performance of the avatar, update answers, get real-time data from interactions between the avatar and the student?
Well, with this level of technical input, I will defer to Ms. Anna Singh, our Director, Curriculum.
So the AI augmented resource has 3 features: the avatar, so that students can interact with, a library of videos and simulations, and then the actual text material where students will actually learn how to approach a particular topic. The material is being, the use of the internet, the use of the technology allows us to update. So that right now we are piloting at Form 1, but over time we would be able to update, yes, and we would be able to update by terms, and we would be able to update by year levels and even by subject. So right now, the initial phase is with the mathematics, other subjects as we go forward. In terms of analytics, so because the resource is on a technological application, we would be able to collect some analytics in terms of students' use and what areas they may have had to revisit. If they did an item and they didn't do well and they have to, it will flag those things. So there are some analytics that will allow us from a national level to be able to monitor. But this would also be supplemented at the school level and at the district level with monitoring structure in terms of examining at the class level, at the school level, students' engagement and as well as teachers' support, we also know that this resource will allow parents to be able to interact with materials as well, whereas they may have had a challenge before, but given the avatar and the resource in the form that is, so we also expect that we'll be able to collect some data from all parties, student, school, and parent.
Thank you. Just two follow-up questions based on it. The first one is just to confirm that the data that you will collect will also be accessible by the teachers themselves, so that the teachers can utilize that data in terms of lessons preparation, to get an idea of those students who are dropping behind, those students who are performing well.
So the analytics will be collected central at head office, but the reports would be made available. This particular application at this point does not allow for the analytics to be driven directly to the teachers in terms of at an instant. But certainly the data can, the reports will be shared.
And the data collected, is it high-level data, or would they be able to get granular data specific to specific students?
At this stage, in terms of its development, it will be more high-level data. It will not be, at this stage, very granular. However, what we expect is that the teachers, it is true, learning continues at home, so students will have access to the resource and continue, but at school, the intention is to ensure that the teaching, the instructional program works in tandem with, so that the teachers themselves can observe the students and be able to support in real time. In addition to this, once the application becomes fully developed and integrated into the ministry's SLM, Student Learning Management System, where there are e-classrooms set up, it would be possible as well, once administered through that those portals, the teacher would have more intimate information and interaction. But as it is, we have not been able to advance it. We are still at the stage of the overall development and the high level, as I say, data at this point in time.
And can I just, one final question on this. Obviously, you have Form 1 students who will be accessing this, and in many ways, in many cases, they may be accessing an AI interface for the very first time. So there's going to be a learning curve, and the gradient of that learning curve is going to differ widely, right? What is the plan in place in terms of tutorials to have both the students, well, the students, teachers, I think you did speak about that training for teachers, but students and parents, to get them up to speed to be able to maximize the use of the interface itself?
So the implementation plan takes into consideration the phased training or the series of training to be afforded to parents as well as teachers and even students. So we do have certain guidelines and the development of materials and actual training to be scaled accordingly. Those are through various modes, webinars, through face-to-face training, through on-demand as well. What we intend to have is to have these guidelines embedded into the device as well, so that you don't have to have a person fit into your time frame. Parents can continue after school time teachers, students can access throughout.
Chair, through you.
Just before we move on, could you provide the committee with those guidelines in writing, the guidelines that will be embedded? Because, I mean, I appreciate the anytime, anywhere learning objective, but we'd like to have sight of those guidelines. Thank you. Mrs. Roberts-Radgman.
Yes, please, Chair. Thank you. I have a follow-up to this question regarding the use of the AI avatar, and I think it's a brilliant initiative, especially considering that post-COVID, our students have been learning very differently. My question has to do with a concern and an observation that was highlighted in the written submissions, and I think Ms. Augustine had mentioned it in her initial thoughts regarding seeing some connection between student underperformance and students who live in rural areas as well as in low-income areas. Because the avatar involves the use of internet, some sort of data connectivity, what are the ministry's plans for ensuring that students in rural areas with unreliable and in low-income areas with unreliable internet access, or with no internet access for that matter, that they are also able to benefit to some extent from the use of this AI avatar? Is there any intention to collaborate maybe with other ministries, with social services, to ensure that they also have some opportunity to make use of this?
Through you, I think I could start the response to this. The ministry is definitely cognizant of the challenges that the member just raised, and it is our intention to collaborate with our colleagues at the Ministry of Public Administration and Artificial Intelligence. That ministry currently has mechanisms in place that seeks to address what we call the digital divide, particularly in the rural communities. The ministry currently has 23 ICT access centers in a number of remote communities, as well as 7 TT Connect centers. So through the use of those centers, we seek to provide internet access, even computer and IT training for residents. We hope to address the challenges of ICT connectivity. But in addition to that, the application will be loaded onto the machines and may not necessarily require internet connection. So once you charge your device, you should have hours of usage without internet connection. So, yeah.
Thank you. Minister Ratiram, did you have a question next? Okay, so we'll move on to a question on collaboration.
Chair, I will take this question. Yes. Good morning, folks. Under governance and collaboration, the submission mentioned the Inclusive School Project, which incorporated the Ministry of Health, the former Ministry of National Security, and Ministry of Social Development and Family Service, as well as various divisions within the Ministry of Education. This is outlined in page 11 of your submissions. Can you provide us with some further clarification on the current status of the Inclusive School Project that you mentioned on page 11?
Chair, I'd like to direct that question to Dr. Nurse-Carrington, Manager, Student Support Services.
The Inclusive School Project targeted both primary and secondary schools across different districts to be able to build what we call equitable and fair conditions for our vulnerable and students with special needs. This project began in 2019 and it ran from 2019 to 2022. And in this project, what we saw was a lot of infrastructural work, because you recognize that these students with special needs needed some additional support. So they did infrastructural work, for example, putting in those ramps, adjusting bathrooms in certain schools, tactile pavements, and I spoke to accessible toilets, elevators. And we saw that overall, across the different educational districts, a total of 45 primary schools and 13 secondary schools, we were able to put in some infrastructural adjustments there. Also, teachers were also trained on further supported on how to treat with students with special needs during this particular project.
Thank you most kindly. Can you identify in which location was the project implemented? Was it conducted in schools nationwide or was limited selected schools? Well, you did indicate 45 primary and 35 secondary. With 30?
13 secondary.
1-3. I stand corrected.
1-3.
Yeah, can you give us a idea in terms of the distribution of these schools?
The project was conducted in the Caroni Education District, Port of Spain and Environs District, Southeastern District, St. George East, St. Patrick, and Victoria districts at that time.
Chair, may I move on to there's a follow-up on 10.
Can I ask a follow-up? You mentioned children with special needs, and it sounded very much to me like you were referring to physical disabilities. What about the other special needs they addressed in this project, like mental health issues and ongoing learning disabilities, etc.?
So during that time, they looked at both the physical and the neurological needs of the students identified. So again, training. Training was one of the important areas, as teachers needed to be supported in how to treat with a child with special needs, how to identify. And tailing on this project is the pillar focusing on the children in this new initiative where we look at universal screening and treatment. So even though the project came to a close in 2022, we would like to move along because we recognize there's a need to continue this type of work. So through the screening, the early identification and screening of children 4 to 6, we want to continue that they started to do in the Inclusive Project.
Thank you most kindly for your submission. Just following up on that, in addition to mental health, from the document you submitted, it spoke to nutrition initiatives for students with special needs as well. Can you identify if there has been cross-sectorial partnership providing that level of support for students with special need from a nutritional standpoint?
What I can say is that our special ed teachers and our diagnostic specialists continue to support parents and advise our school administration as to the needs of our students with special needs. To delve deeper into that area, I think we may have to provide that in some writing.
Also in terms of tying that back to things like the school dietary program, where the students with special needs from a nutritional standpoint is taken into account part of the National School Feeding Program.
Chair, through you, maybe I could initiate the response. Yes, the member is correct. The Ministry of Education is currently in the process of actively reviewing its dietary program, both in terms of the meals that are provided through the NSDS, the National Dietary Program. But in addition to that, we are also looking at the policy that governs and administers food items that are provided in the cafeterias in schools. And in that regard, we have collaborated with the Ministry of Health and obtained its feedback in terms of the guidelines that we would provide to concessionaires for cafeterias in schools, reducing the sugar content of beverages and snacks, managing the fat content, sodium content. There are certain items that would be prohibited because we are very concerned about the welfare and the health of our children. We stand on the principle that a healthy body contributes to a healthy mind for all students. Yeah.
Yes, so Chair, I just want to take a moment to congratulate PSD team and Minister, of course, who I know is really spearheading this initiative when it comes to sugar content and healthy snacks in our nation's cafeteria. It is something that is definitely not only going to benefit the children, but the country at large, because when we look at what is happening with our health sector and the huge burden that the health sector, when it comes to funding of comorbidities, etc., these are things that are developed from early ages in life. So it's an excellent initiative there. I just want to move on to the coordinated efforts with the Ministry of the People, Social Development and Family Services to deliver financial assistance, counseling, and community-based intervention for families of children with disabilities. Yes, Chair, through you to the PSN team, can you elaborate on any kind of support system that this coordinated efforts would have been able to provide for these specific students?
Thank you, Chair. Again, I direct to Dr. Carrington.
We at the Ministry of Education, we partner with the interministerial and interdivisional divisions to coordinate different aspects of support for our students. So to speak specifically with the Ministry of Social Development, our school social workers, they are the ones who would do the assessment of students. And for example, if they need any grant support, they would be the persons to make that link so that the parents of the students are able to get the different grant support needed to support their children. And most of the times, the parents are not even aware of what support they have. So the school social worker would intervene at that time, and they would do a full assessment at times, which may include a home visit, and give that type of support to the parents so that they're able to receive what they need for their children.
Chair, if I might. Just one follow-up question for Dr. Carrington, please. Dr. Carrington, the ministry's submissions indicated woeful under-resourcing or, I don't want to say, lack of staffing in terms of school social workers. So there's a gap, there's a lack of school social workers, and then you indicated that the school social workers will usually make the referrals and seek the necessary support for students. In light of the understaffing or unavailability of these social workers, what other interventions has the ministry implemented or intend to implement to ensure that the students are actually getting the referrals that they need to access these additional supports?
The ministry has a cadre of workers, school social workers, and what we have done, we have reorganized how they work. So, for example, in the primary schools, they work in cluster approaches. So one social worker can go to 3 schools. In the secondary schools, we have a more targeted approach where you have one social worker to 1 school. So with that type of deployment, we are able to cover. Now, even though the caseloads may be high, what we have is critical incidents. So the critical ones we deal with immediately. The others, they will go through that referral process and assessment processing. So we do try to meet the needs, and this is why we collaborate with the other ministries to get that further support. So once we recognize that we have done the interventions, because we have a tiered approach at SSSD, social workers are not the only forms. We have the different tiers. Once we go through the tiers and recognize that the intervention needs further, we do external support for the parent, the child, and the parent.
Thank you, Chair. Just one final follow-up. Thank you, Dr. Carrington. In terms of the critical cases, can you give me the average turnaround time in terms of getting a response from the other ministries or agencies?
We at SSSD have a really great relationship. So we work with organizations like Children's Authority. We work with National Family Services. We get support from the Ministry of Health. So once our officers on the ground, or even our senior officers, connect with the relevant senior, they, depending on the crisis level of the case, for example, if it's a suicidal ideation, that will be treated immediately. It all depends on what the case is. So we can get immediate, and then there are some which we have to, so basically we do a triaging of what we do to help manage.
Thank you, Chair. So, Chair, through you, I think we've started on a line of questions, and that's, if you don't mind, I would like just to continue on briefly, right? In the objective 3 laid out was to evaluate the capacity and effectiveness of the Student Support Services Division and intervention for students. And seeing as Dr. Nurse-Carrington has started to answer questions, I think we should just continue on there, right? Chair, if you don't mind, could I get, just from my own knowledge, a brief explanation of what developmental assessment and intervention is and what special education is?
So the developmental assessment and intervention unit is that unit that hosts our psychologists. We have 3 different levels: clinical psychologist, school psychologist, and behavioral therapist. So these are the persons that conduct the psychosocial assessments and the treatment therapy. They are what we regard as our level 3, the tier, in the tier program. When we have already done all the assessments and we recognize there's further intervention, this is where we refer them to those persons. In terms of special education, that is the unit that treats with identification of learning challenges in our students. So they will be able to, say you have a child in first year and the teachers are saying the children can't read. So what they will give, if they recognize certain things in a child, they will try to provide some strategies to help the child understand what is going on. They also provide manipulatives for the child to work with to be able to understand what is happening. So you want me to elaborate more?
Just so for my layman's understanding, one speaks to behavioral issues and one speaks to learning
so
issues.
The DAIU unit deals with the psychological and the behavioral issues. Special ed treats with learning, and they may also come in contact with some learning, some behavioral issues.
One being a symptom of the other.
Yeah, it is.
So, Doctor, can you tell me, I mean, we do have on page 27 of your submission, table 1 gives us a clear understanding of your staffing, your offices, those positions that are filled, and of course those positions that are vacant. And so maybe the first question I can ask is there an active pursuit in terms of filling these positions, and when, see you have looked to your PS, and when we can expect those to be filled?
Chair, through you, member, yes. So the ministry is very aware of the staffing challenge facing the Student Support Services Division. Given all kinds of issues that are currently happening within the education system, that division is of particular importance and value to the sector. So our Human Resource Management Division has been charged, mandated to aggressively pursue recruitment and filling of those positions. I might add that I think the majority of the professional technical positions in the Student Support Services Division are currently contract positions. All right, so it is the remit of the ministry's HR division to advertise, recruit, select, fill those, as they do not fall under the Service Commission's department. Just in preparing for today's hearing, we were discussing up to yesterday the issue of what is the supply on the market for those positions. And we do intend to reach out to, for example, the University of the West Indies, UTT, and USC to determine, well, what is their turnout over the past few years, so that, you know, we have realistic ideas as to what is the supply out there and how readily we could fill positions.
Yes, you've preempted my next question.
My apologies.
Of course, PS and Dr. Nurse-Carrington, they may very well be an issue in terms of persons who have not just the necessary qualifications, but you would have that experience as well. So maybe the thing I should ask is there a shortage of people who have that combined qualification and experience?
Over the past 3 years, as I sat there as the manager, what I would see in the interviews is that we would get a crop of persons who are well-grounded in theory. But when it comes to application and understanding the school environment, understanding the realities of treating with a special needs child or a child and parent from a vulnerable community, that is where the challenge comes. And regrettably, some leave as soon as they come because they can't treat with it. So in looking at that, we have had conversations not only with the University of the West Indies, Costa, and USC, because they would send practicum students to us, so at least they get that overall experience. We have had that type of conversation to help them understand the navigation of the school environment and dealing with different types of parents. So, and we continue to work closely with the universities to help to more streamline the training so that when they come to us at SSSD, they're more prepared to really understand the needs, because we try to meet the students at their need.
Chair, just a couple more questions, if you don't mind. In particular, Dr. Nurse-Carrington, the development, assessment, and intervention, can I say unit? Yeah? Given and maybe I should preface this by saying I still have school-age children, right? So one of whom is in first year doing psychology at UWI. I'll make a note of our conversation here. I do note, however, that as a parent of school-age children, you do hear a lot more about diagnosed ADHD and those and other similar types of diagnoses. Do we think that the unit of 34 fill and 44 in total is large enough to meet the needs of the student population?
Through the chair, would you permit me to make a correction for the numbers? It's 42 positions created, 21 are filled so far. Yeah, so that's an error. My apologies.
So you're 50%.
Yes. So that's a very good question. The psychologists do not operate as the others units in SSSD. They operate only on a district basis. So we can have one psychologist for the district, one type of psychologist, or even two, sometimes you stretch. So you may have two clinical psychologists, one school psychologist, one behavior therapist. Clinical psychologists and school psychologists do something different from the behavior therapist. And they treat with the assessment aspect. So no, we don't have enough to assess the students because they work by the district as opposed to work by the school, with the individual school. If we look at the American Psychological Association, the ratio they are using is 1 to 250. My officers, a district can have over 100 schools. So that is what we are working with. So the numbers may look high for SSSD, but the type of interventions that each of the units have to supply is tailored to the needs of the child.
Yeah. Chair, that then takes me to another one of the MOE submissions on page 28. Because, Doc, if you say that these numbers that you're talking about directly impact the assessments themselves, right? But if I look at table 2, in terms of referrals received and addressed for the period September 24 to July 25, you have an extremely high percentage complete when it comes to addressing these assessments. I suppose maybe the first question I should ask is this a I don't want to sound as if I'm, but is this a real number? Is the assessment or the referral mirroring the actual issues that may exist in the system itself?
Through the chair? So what happens, this is a real figure because we would have received, for example, in the primary school, 5,429 referrals. So every week, the multidisciplinary team would collect those referrals of the cases from the different schools, be it primary, be it secondary. So it was received and it would be processed during the MDTs, which is the multidisciplinary team. They choose a day in the week, they sit and they would process and assign the cases. So that, yes, we have the 100. We can have full contact on that. Where it becomes a little more technical is the implementation of the interventions. That's different from receiving applications and addressing it. Because once you receive it, we go through the case file, we decide which unit deals with it, and we assign. Yeah. But then, because of the numbers, the ratio, it takes a little longer. Sometimes it's not a very critical event. It may take a critical incident. It may take longer. We try to process and do that in a span of 14 days of initial receipt. So even if you're just making the contact with the parent, organizing the assessment, to go to speak with the parent, to go to the home visit, that is done. Intervention continues, whether it's a counseling session, whether it's a group session, those will continue over time. So, yes. So
we should take this figure not as the closure of a quote-unquote case, but the end of a phase in the process.
We can use it as a phase in the process because different cases will end at different times. So some cases we tend to use 6 counseling sessions as the bench because we do using international practice. And after that, we may still need to do further intervention. So then the social worker may then escalate that case to the DAIU, to a psychologist to do now a psycho-ed on that child. So these DAIU officers not only deal with these cases that's come up, but they also do psycho-eds in preparation for concessions. So, we're stretching them, but they're doing what they have to do.
And is there reporting generated based on that phase of the process? So what students, in terms of the actual interventions themselves?
Yes, we can get that for you. I appreciate it. If you would like to see the number of students referred, the number of interventions completed, Well, yes, we can do that generally. We can't tell you exactly what is going on because of
No,
confidentiality.
understood, yeah.
But yes, we can capture what types of interventions, whether it's counseling, whether it's psycho-ed evaluation, we have that.
I think the reporting that comes out of that is actually more impactful in terms of what we're looking at here than this initial phase of the process.
Yes, and if I may add, could you also include the time frame for those? For example, a psychoeducational evaluation, how long would that take from bringing a child to the attention of the ministry and actually getting a report in hand that they can use for concessions, etc.? Because my understanding is that it's an unacceptably long time. Is that your experience?
It varies. Once we have the bodies and the documentation to support all that is needed for the psycho-ed, it can take a month and I just want to say probably a month and a week. If we have all of the documentations necessary. If not, sometimes we don't have it. So we have to be rescheduling appointments with parents. It all depends on parents' availability. It all depends on if the school sends everything. So it takes longer. But if you have everything in place from the parent side, the school side, we can run that. But if most of the times we don't have it, so it takes a longer time. Sometimes it even takes about 6 to 8 weeks to get it done.
That's my point. You're making the point that most of the time you don't have it. So we're actually talking about vulnerable, high-risk children and the concept of intersectionality, and where there are multiple factors that would prevent access of these children to the services that are available. So my question really is, what is being done to help the most vulnerable children who really are the ones that we are trying to help? Because you're telling us about a best case scenario, and I suppose what we're asking is, what about the worst case scenario and those children who fall through the cracks? So I really would like to get a sense of the genuine scale of the problem and how many children are we losing because of understaffing and under-resource or parents who don't understand the system. Because essentially what you're saying is that at best we have a flat line. And I think what we're expecting is to be seeing improvement in terms of performance or reduction in terms of underperformance.
Can we present that for you in writing?
Yes, that's fine. Thank you. I wanted to follow up on a question about attrition of staff who seem to become overwhelmed by the real life situation as opposed to the schooling and classroom style degree. So my question is about mentorship, not just for your division, Dr. Nurse-Carrington, but generally in terms of the teachers and the mentorship program. Now, you mentioned in your submission that there's a mentorship program and a teacher induction program. That's on page 34 and 35 of your submission. But I am getting the impression that this mentorship is more to do with professional mentorship and not necessarily social or personal mentorship. So could you tell me more about the mentorship program and the support systems in place for teachers and counselors who are very junior in the profession?
Chair, I think the response to that question could be shared between a number of persons on the team. I'd like Dr. Smith, CEO, to address teacher mentorship and development, and we could swing back to Dr. Nurse-Carrington for the mentorship within her division.
So, Chair, as was mentioned, there is a teacher development unit, and currently I can give you an example. We would have had 328 senior teachers, vice principals who were trained to supervise junior teachers. Actually, yesterday we had a graduation ceremony in which 326 junior teachers would have graduated from that initiative based on the mentoring that they would have received. In addition to that, within the school system, it is also part of the job description of officers to provide that level of mentorship to new and beginning teachers on an ongoing basis. So there is something in place in terms of our training as well as what takes place within the school environment.
Could you elaborate on what that mentorship entails? Because mentorship, there are many aspects to mentorship. So I don't know if you would be able to give us an idea of what the mentor-mentee relationship is supposed to embody and how the mentee is supported by the mentor.
Okay, so Chair, can I give you that, provide that in writing, please? Okay.
Yeah, certainly, but
Yes,
could
certainly.
you maybe give us summary while we're waiting to get a more comprehensive? Okay. Could you just give us just a brief overview of what the mentor is, the expectations placed on the mentor and their role?
So normally what would happen on an annual basis, we would have new teachers being exposed to this program, and as part of that program, a more senior teacher is required to supervise the junior teacher, so that one of the things that they would conduct would be clinical supervision. They would observe the practice of the junior teacher or the mentee as he or she delivers based on the modules that they would have been exposed to during the course of study.
Yeah, but that's still just professional mentorship. What about the other aspects of mentorship? Do junior teachers get that sort of psychosocial support so that they feel motivated and that there's no attrition or loss of experience? Do you understand? So it's not just the professional side, but the other aspects of mentorship.
Chair, maybe I could refer to our Director of School Supervision and Management, Ms. Carter.
Good morning, Chair. With schools, we have a holistic approach to how we mentor teachers. So it may not necessarily only be for academics. We have a whole school approach where we deal with the social side, if you are acclimating well to the school. So we might have different activities. So if you look at the life of a school, we not only have classes, we have clubs that teachers can be part of, we have sports days, we have awards, we have teacher recognition. So it's a holistic approach to how we mentor teachers and get them acclimated to being a teacher. So it is not just the classroom. So with the principal, vice principal, heads and deans, as well as we have our NPTA and many of our NGOs, we also have professional development. We may have well-being sessions. And so it's an entire approach. So we have other divisions like teacher education, performance, and professional development, where we'll do with the pedagogy. But in terms of the holistic approach, we do have different areas. And if you look at the life of a school, we ensure that new teachers, as well as those who've been there, will acclimate and have what we will call collegiality and collaboration in a compound. So that is one of the things. So when junior teachers come in, we ensure that they acclimate. And of course, if those who are not acclimating well, we have the EAP, and many times you might find the principal may recommend EAP, and we do have that as well. And school supervisors will go in if there's anything or any teacher who may not be acclimating well, in order to ensure that there is a level of comfort when they do actually go into the schools.
Thank you for that answer. And is there a difference with the acclimatization of teachers in the high-risk schools as opposed to the other schools? Have you noticed any that they need more support, and are they getting the support that they need?
Well, one of the things that we have looked at is tailoring professional development specifically to those schools that may have those. And so we will be in collaboration. And so schools that may have high risk, we would find that we have more trauma-informed practice. So, so that was how do we deal with students who are also traumatized, and in that, how do we look at students? So their reaction to certain things may be different because of their traumatic experience. And also students who grow up and become mature, they are also trauma. So we look at the trauma that adults may have. And so trauma-informed practice, we would have professional development. So we look at the well-being of the teacher and the well-being of the student, so that both of them, when they go into the classroom, so you'll find professional development will be tailored specifically more for those where we have schools where children might be high risk or in trauma communities. So trauma-informed practice is what we have been discussing to a great extent in the School Supervision and Management Division for schools in high risk and those students who might be placed in high risk, and how to equip teachers to deal with that, so the trauma-informed practice.
Thank you. Just one final question before I hand over to committee member Rogers-Radgman. Do you know what the general attrition rate is among teachers, and are more teachers leaving the service than previously?
Well, I cannot give you the specific data at this point, but we can get that for you. But I believe that most you would find were those who are migrating, but generally we don't have persons. But I can't give specifics, but we will provide that data should you give us a chance to do so.
Thank you.
All right, thank you, Chair. Through you, Chair, I want to shift the focus a bit back to the individual support for students. And the ministry would have mentioned in its submission, and the exact quote was that the ministry refers to external agencies, and we'd have touched on it very briefly, and professionals for the provision of speech or language, occupational and physical therapy services that are not provided internally, meaning not provided by the ministry. So I have a few questions around this. The first one being, how long does the referral process usually take to the external providers of these therapy services? How long is the external process? The referral process, sorry.
Once we have identified that there is that particular specific need for that child, we would do the referral immediately, and then it depends on the external agency as to how long they will treat with the case coming before them.
Thank you, Dr. Carrington. Have you seen, is there a trend? Could you say on average how quickly you get a response from the ministries, or does it vary?
It varies. Sometimes we have to work with child guidance on certain areas, and because of the volume of cases child guidance has already, our students tend to have to wait a while.
Are there any mitigating actions that can be taken or that are taken on the ministry side while you're waiting to ensure that the students still getting some support in the interim?
Yes. So, for example, SE, which is a critical area, what we try to do is prioritize the concessions, the students who have applied for the concessions, prioritize their psycho-eds. So even though we may have a number to do, right now they are the priority, and we would try to work on them so that their parents can get the recommendations for their concessions before the exam. So we try to do the priority.
Yeah. Thank you, Dr. Nurse-Carrington. In terms of the cost for these external services, when the students receive the services that have been requested, is this covered by the Ministry of Education or by the ministry that's provided the service?
I can say that we don't cover the cost there. However, I will have to find, we can probably submit that in writing if the other ministries may cover that particular cost.
Sure, thank you. And just high-level overview, who are the other ministries currently that you tap into to get these external services?
We work with the Ministry of Health. We also work with the Ministry of Social Development at this time. Community development also.
Community development, health. All right. Thank you, Dr. Carrington. Oh, you have a... Sure.
Chair, through you, just as a follow-up, When I was reading the submission from the Ministry of Education, and this relates to what we're talking about here, the sort of the individualized programs. There were three figures that I sort of jumped out at me. One is 11.65%, which would be students scoring below 30% at SEA. 29.35% students, these are national figures obviously, at CSEC who get 4 to 6 or ungraded, and then 17.68%, which is the national figure for no passes. Does the ministry, of course these are numbers, but these numbers refer to students. Does the ministry have a mechanism by which they track these individual students, starting from the student who falls in this 11.65%? Because the reason I'm asking this, Chair, is that there's a confluence between persons who are in that percentage and also in the grouping that would fall under truancy and that sort of bad behavior in schools. Is there any mechanism by which the ministry tracks?
Through you, I'll direct Chief Education Officer Dr. Smith.
Okay, so Chair, the Ministry of Education, through its various mechanisms, for instance, this year we would have embarked on using an online registration system for first-year enrollment, which would mean called FIRST, which would mean that going forward we are able to track students through primary and into secondary, and through the student management system it also affords us that opportunity. So we have systems in place to track students as they move through the system. As indicated previously though, we do have a system whereby we are able to track students from SCA all the way to CSEC, so that we can look at the correlation between their performance at SCA and the eventual outcomes for CSEC.
Thank you. So, Dr. Smith, the way that SEA works is that the students who would fall in this 11.65% ultimately may get just simply placed, right? So, am I correct in assuming that these students would invariably end up at very specific secondary schools, or would they be widely dispersed across the country?
So they may end up at specific secondary schools in some instances.
And therefore, those schools themselves would have an inordinately high number of students who would be considered by the metrics set out here as being underperforming. You are correct, member. And can I also ask if, given the reporting that exists now, if we see also an inordinately high level of incidents that require the intervention of the support services division for either behavioral issues or learning disabilities?
You are correct, member. And when we saw that based on the previous data, hence the initiatives that would have ensured that we had dedicated persons, school social workers and guidance officers to service some of our schools that we would have defined as high risk in the past, but they are more priority schools at this point in time, even to the extent whereby we have established and ensured that those schools had special rooms outfitted for SSSD personnel so that they can actually conduct their business in a safe and secure environment.
Yeah, it brings me back to Dr. Carrington's earlier assertion in terms of one, the psychologists and those other resources that are required. Because we would be talking about, instead of one per division, you're really looking at a requirement of maybe one per school in these instances. Yes, it seems that you have a task on your hands.
Okay, Chair, if I may, apart from our recruitment drive to fill vacancies, the reality is that even though the Student Support Services Division currently probably has around 700 positions, professionals on its establishment, we have in our education system across all the sectors approximately 300,000 students. That is a challenge. So what we have recently done, we have approached the Ministry of Public Administration and Artificial Intelligence for the input of its public management division to come in and conduct an organizational review for the entire ministry. One of the divisions of focus will be the Student Support Services Division. Because yes, we may want to fill current positions, but from everything we've heard, whether anecdotally or otherwise, that division needs to be strengthened. So I can't give an exact timeline. We had our initial meeting with the PMCD on Monday of this week, but they will be assisting us in determining what is a better number in terms of the strength for the division.
Thank you. I'd like to follow up on one of the numbers, the stats, the 11.65%, because that's really a very important group. My question is, why are these underperforming students who are expected to score 30% or less made to write the SEA, apart from the fact that it's mandatory? I mean, is there no other option or system in place for these students? And I suppose as a follow-up to that, I know that the recommended class sizes are 30 students per teacher in primary schools. Are these priority schools, as you refer to them, is there any consideration being given to reducing class sizes in these schools to cater for this 11.65%? And I just want to know if we could just direct our attention to that very vulnerable group.
Chair, I'll direct Dr. Smith.
Chair, can I ask you to please repeat the question?
The first question is really, why are students who are expected to score 30% or less mandated to sit an exam that they are doomed to fail when we know that they are underperforming? Is there no other option for those students? And the second question is there any consideration being given to reducing class sizes in these priority schools, understanding that the recommendation made is for 30 students to one teacher nationally?
Okay, so I can probably attempt the first one. So the current system that operates within Trinidad and Tobago education system is that entry into secondary school is based on the secondary entrance assessment. There are some students, Chair, who do not sit the exam. They would more or less go through alternative placement at the request of the parents, and that's in very dire cases. Okay, Dr. Carrington can perhaps elaborate after on that point. One of the areas, one of the things we have been exploring is the use of the continuous assessment component, perhaps at an earlier age, let's say standard 4, standard 5, that would allow us as a ministry to ensure that we bring our students up to a higher standard. and hence the importance of the screening, hence the importance of the parental initiatives, because when we look at sometimes the students who score 11 well, that 11%, sometimes it's students who come to school at a late age, frequent absenteeism, challenging home environments, and hence the need for us to really improve on that social support for those students as well as families so that we can address and minimize that 11% of the students who score pretty low. In terms of the secondary school and in terms of actually reducing the class size, again, because the SCA operates as a placement exam, unless we perhaps build additional schools, it is a challenge, Chair, to actually reduce the class size. Or reducing class size would involve more classrooms, more teachers going forward, and perhaps in some instances, more schools, especially in certain highly populated education districts.
So, in other words, the student-to-teacher ratio needs to be adjusted by employing more teachers, given the physical limitations of the physical infrastructure.
In some instances, Chair, yes.
So consideration is being given to that for the priority schools, to increasing, since we can't increase the schools, I'm assuming, to increasing the number of teachers assigned to those schools?
Chair, maybe not answering the question directly, but just to address the issue of increasing the number of school places, the ministry acknowledges that there are a number of schools that are currently incomplete. Construction started some time ago and they were not completed. There is a plan to commence the completion of those schools, and particularly those in the at-risk or the priority areas. So once that happens, and of course, those schools are at different levels of completeness, ranging from foundation works, or maybe a school being 50%, 90% completed. But certainly we want to target for completion those schools in the priority areas. So once that is done, and it may take a couple years to complete them, we will be able to provide more spaces. And of course, consider what you just proposed, addressing the student-to-teacher ratio. But I think a key issue would be the number of places and spaces that are available.
Yes, I hear you, but also, and that 2 years seems to me to be a long time in the life of a child. But what about increasing the number of teachers so that you have more? And that leads me to a question about teaching assistants, and so more support for teachers in the existing framework.
But still those, and yes, I hear you, Chair, but they still have to operate in the same fixed physical environment. So even if we have 5 more teachers, where will they fit? That's a challenge.
But wouldn't that align with the individualized educational plans for these students that you mentioned? Because the question that I'd put back to you is, how could one teacher implement several individualized plans within a single class?
I suppose the response would be, we will definitely want to consider it. Again, we have a talented and committed team. We can find a way.
Yeah, and just to end on that point, because when the schools are built, you'd still need to have teachers for those schools. So you still need to employ more teachers anyway. So it would be an easier transition, I suppose, if they were already employed. Yeah. Thank you. Member Rogers-Radgman.
Thank you, Chair. Chair, because we're on the line of questioning around these high priority schools, and the interventions that are needed to support these students. And we've noted that there are a lot of, I guess, psychological, psychosocial, socioeconomic, and other concerns or factors that impact performance and behavior in these schools. And the ministry would have mentioned in its report the restorative practices intervention strategy. And then the report also highlighted some challenges faced by institutions. You're talking about absenteeism, tardiness of students, and of teachers, inconsistency in how the strategy is implemented, and then obviously the impact of some of the home environments, the mindset of even parents. So my first question has to do with the role of the principals in encouraging and motivating teachers and staff, because one of the issues mentioned was tardiness of teachers as well. So how do the principals operate to motivate teachers and staff to participate in these sessions? And does the ministry provide any guidance to the principals?
Chair, through you, I'd like to direct our Director of School Supervision, Ms. Carter.
Good morning. So schools are a place where, first of all, teachers have their job descriptions, and anything that would, add to that, there is something where we have a collaborative, collegiality. And of course, teachers recognize that the more skills they have in learning about student behavior, you find many of our teachers, I can't provide the statistics, many of the teachers actually do participate in training. So we have a culture where teachers are hungry and ready for training. And so it may not necessarily be that they may not want to participate, but the life of the school comes into play where you have your exams, where you have parental, the engagement, and they also have their needs in terms of the amount of contact time they have in terms of delivering the curriculum. So it's all about a balancing act and not necessarily a lot of interest on the part of the teacher. So we do have, in terms of a timetable structure and the amount of time that we can allocate for other programs as opposed to academic. We also have parent-teachers association, parent-teachers meetings. And so parents, some of them are extremely vigilant, and they might look and say the timetabling over that year and this term might have changed. So it's all about balancing the interest of the parent, the teacher, and of course the education system in order to make improvements. So when we introduce something for the first time, there would always be teething problems, how we work it out. But as we progress 1 year to the next, there is the expectation from the parents that we have this new program, and it, of course, is all about communicating why we do something, and as opposed to if it's 100% academic, but we also have the social aspect of the child, the emotional. So in our bid to say it's maybe the teachers lack, it could be the pressures coming from all the areas, but as we progress from 1 year to the next, we are hoping to see that would be changed over time, and as persons get accustomed what has been newly introduced, it will become part of their daily understanding and skills and approach to improving practice in the classroom. So it may not also be academics, it can also be how do I use this new skill in order to bring the mentality of the child to change within the classroom for them to understand that education is important, as well as mixing that with teaching. So it's a holistic approach and to how we introduce new programs to our school system. And of course, the 3 pillars, we have to work for the 3 pillars to integrate over time.
Thank you, Ms. Carter. Chair, through you, a follow-up to your response, Ms. Carter. You would have mentioned that it's a new program, which means additional responsibility for teachers and even for the principal. So I guess my question is more around the support that's given by the ministry to the principals and then ultimately to the teachers as they take on this additional responsibility, taking into account that beyond the training that they might get in delivering the instruction, it does come with an additional weight, whether that be to understand the I don't know what you call it, the social aspect of it, the cultural aspect of it. So what sort of support do they get?
Well, the support would be, of course, if it is that we have the deans, So the deans are also there to support the form teacher, the discipline, and areas in which the social and emotional development of the child. So we have the heads of department who would assist in terms of mentoring, and we have the deans who have that other aspect where they would probably oversee and lend that support in terms of that part of the child. So it's a holistic approach, and we have different roles and responsibilities of officers. So the deans would be the ones who would be charged with the responsibility of providing that support. Of course, we have the principal, vice principal, but of course the middle managers of the deans would support that area of any programs we have at schools.
Thank you, Ms. Carter. So just so that we're clear, can you, without going into too much details, but can you sort of talk us through what the restorative practice session itself looks like? Because I get the impression from the report that it's something that happens outside of regular classroom instruction. Am I correct?
So I'll have to defer.
Chair, we'd like to defer to Dr. Carrington. That's her area of specialty.
Restorative practices deals with relationship building and repairing harm. What we recognize that in our school environments, we have seen the harm that has been caused. And sometimes the harm is not generated in the school. It starts from the home, from the community, and is now brought into the school. So this is a practice that is used globally to address harm. Harm from the offender, harm to the victim, and bringing that measure of accountability into a safe space where students can voice how they feel about being harmed or how they feel about doing the harm, encouraging teachers to participate in recognizing the harm, and also parents and persons from the community. So it's a community-based approach in relational management. So a session, what we are encouraging and what the 400 education personnel, they were trained in restorative practices in 2023 and did make up of the principals, vice principals, deans, our SSSD staff, our safety officers. They were trained specifically in circles, also restorative leadership, emotional intelligence, and self-care. These circle sessions in the pilot schools are held in the morning and in the afternoon. So we do a check-in and a check-out circle. Why? We recognize that in the morning we have to settle the students. So students are able, you give them a topic, and they go around in a circle with a talking piece, and they're able to voice how they feel. We are able to now gauge what is happening in that particular environment at that time with this particular student. Sometimes students come late. We don't know why they come late, but they're coming late. And in that circle, we understand why they may come late. So it also gives us an explanation of why this behavior may occur because of this is happening. So we use it in the morning, and we also use it after lunch, because we recognize that after school they wanted to have all these other interactions. So we try to catch whatever possible brewing infractions in the circle time after lunch. And the circles are just one of the interventions. We also have restorative dialogues where it can be something casual. You see something happening on the corridors of the school, and the teachers or the practitioner can engage the student there and then. We have something called the reintegrative session, so students have been suspended. Before just coming back into the school and coming back into the community, we have sessions with them, making sure that they understand why they were suspended and how they have to be accountable for what they have done, and what type of harm or what the impact of your suspension may have had on your classmates, may have had on your parents, etc. So it's really a practice of consistency. And if we're not consistent, then the practice is going to fail. So we have to be consistent. It's a life change, and we are trying to encourage with our students, our parents, and within the school environment.
Thank you, Dr. Carrington. So just a follow-up for either Dr. Carrington or for Ms. Carter, and thank you for explaining what the practice looks like. In terms of the teachers' involvement, and I guess the reason why I'm asking the questions around support is that the teachers in these high-priority schools, they already have a heavy task in front of them. Even if you just take the delivery of instruction by itself in the classroom, it's already a lot because you're providing instruction to students who, for one reason or the other, might not be able to absorb it as effectively as they should. So they already have that burden placed on them that some other teachers may not have to face. And then now they have the, I guess you could call it the expectation or the responsibility to also participate in this practice, which is a good practice, and I can see the benefit in it. So I guess what I'm trying to figure out is the level of support that's given to them, I guess, for even their mental, for the burden that it places on them, because the report mentioned them sometimes being even resistant. I'm seeing here resistance among parents and teachers. So just taking the teachers, I imagine some of that resistance would come from the weight that they're already carrying. So is there any kind of support that the ministry might be considering to give to them just to take that weight off, especially the mental aspect of it, I guess?
I'd like to direct Dr. Smith.
Chair, if I may, when the whole issue of restorative practice was being considered, even before its implementation, when we look at the literature internationally, what we did see is a certain level of resistance to even the initiative. And it's because it's a different way of dealing with discipline, not a way that we commonly approach. And so we would have provided the training, and that's why we only went with 11 schools rather than going to a large number of schools, so that we can actually monitor the program and see the benefits of it. We have the RP facilitator at the school who provides the support. So someone is actually stationed at the 11th school. There's a RP facilitator who resides there and provides that support, as well as there is the lead who again provides that additional support. One of the things we would have done in some of these schools is that we would have made some adjustments to the timetable so that the load is not as heavy as would normally obtain. Needless to say, if I can just give you some quick stats. So for instance, the restorative circle that Dr. Carrington mentioned, we have had over 24,000 restorative circles, whereby students and the teachers would get together and discuss issues. That would have involved approximately 4,932 students. In terms of the reintegration sessions, those coming back from suspensions rather than just simply filtering back into the schools, we have those sessions now, 374, and we have organized training, 29 sessions, targeting 556 participants. So we try as much as possible to continue to support our schools with this initiative. Interestingly, the philosophy also exists, not exactly like the RP practice, it also exists at the Children's Authority as well as the Children's Court. So it's an initiative, a new initiative, and we do expect there might be some little teething problems, but I think what we are seeing now, we are actually having requests from both primary and secondary schools for the initiative to be extended to their schools. Okay?
Okay, thank you. We're hoping to finish maybe at about 12:30, so in the interest of time, I'd like to move on to Objective 2, dealing with truancy and school dropouts. Minister Ratiram, you had a question?
Thank you most kindly, Chair. I would like to refer the panel's attention to page 21, where the ministry submission stated there was no clear concentration of dropouts in any one educational district. However, Tobago and Southeastern Education District were the most popular for highest dropout rates over the period. P.S. Can you provide some clarification as to has the ministry studied the factors that have contributed to the highest dropout rates in these districts?
Chair, through you, I will direct Ms. Carter, Director of School Supervision.
Good morning. And so we see southeastern and those districts with the highest dropout rates may be attributed to cultural practices. And in terms of that, they are classified as a dropout, which is a year and a month. We have a program where we look at absenteeism. And although you may be a dropout, we do have reinstatement, so they do have access back in. So there is a program where we would ensure that the first instance, it could be 1 day for a month, 1 day a week for a month, 2 weeks consecutive, where we would make some interventions and to ensure that, at times we do not have dropouts increase. Why it is in these specific districts, we will have to probably do a deeper dive. But if you look at it, it's more rural communities with their own challenges. And as we see what we are doing in terms of our targeting with rural communities and increasing our efforts in those areas, we are hoping as we target more interventions in rural communities, we will have a reduction in dropouts as we continue our intervention with a greater focus in the rural communities.
Thank you. However, on page 22, it was stated that there was dropout rates also fluctuate in all districts over the period, except in Port of Spain and the environs, which showed clear patterns of increase. Was the ministry able to identify what are the primary factors contributing to student dropouts in the Port of Spain area?
We would have to, I think, do some more research on that, if you allow us to do some more research and provide you with some information.
Sure. And any measures in place at this time to address the rising dropout rates in Port of Spain or even in the rural communities identified?
Right, so we have a progressive approach that we have. So we have the form teacher, we have the dean, and of course, when we recognize that, like I said, 1 day a week for a month, so we have persons, we identify students who would be on our absenteeism and chronic absenteeism list, and then our intervention with the form teacher, the dean. If we find that they have not returned, we also have our intervention where they are referred to Student Support Services Division, where the school social worker would make their interventions. We also have community police that we also reach out to for those persons we may not otherwise contact through our school officials, because we do have a close collaboration with the community police. So we can also reach out to them to find out the reasons why they are not coming, and they can make contact with the parent, and so that we can do as much as we can for intervention. And also, not all dropouts remain dropouts. We also have reinstatements. They return for whatever various reasons. They were out of the school system, they may return. But as for the specific reasons, we will have to do we would provide that if you would like to give us some more time.
Sure, and just one final question, Chair, as it relates to this matter concerning dropouts. Earlier we would have examined collaboration with the ministry and other government agencies while we can treat and deal with matters for students who drop out or reintegrated back into the system. For those who would have dropped out and basically fallen off the system, has there been any sort of collaboration with other government agencies to pick up the slack to ensure that these children are not just lost by being a school dropout and no one is paying any attention to them after that fact?
I'd like to defer to the PS.
Now, the challenge, Chair, is one, being able to identify, certainly on a timely basis, who the dropouts are, right? As we heard, it practically takes a year and a month to classify, identify a student as a dropout. And of course, being able to identify what were the factors that led to the dropout. The theory tells us that there are a number of factors. It could be health issues, it could be family issues, community issues, poverty. For the students in the rural communities, the sheer burden challenge sometimes of being able to travel to school. But to the extent that we are able to identify who the students are, where they were coming from, the causal factors, that would allow us to identify which government agency or service that we could turn to. So again, that requires a level of analysis that we need to do.
So Chair, I just want to put forward, a simple suggestion. Instead of looking at waiting the 1 year and a month for us to identify a dropout, if we can treat with it from an earlier stage, maybe an at-risk child who may approach dropout status, so that we can start addressing the problem from earlier than we wait until it becomes a bigger problem. So if we can consider some kind of earlier labeling of at-risk, collaborations with other agencies, whether it is school transport, whether it is social services, and so on, so that we don't allow it to grow into creating and having more dropouts in the system.
Understood and accepted, because you are right. If before you become a dropout, you may have been a chronic absentee, right? So that would definitely signal some kind of intervention that, and they do take place, whether between our school supervision or even our student support services division. But you're right, we can take some proactive steps.
Mrs. Roberts-Radgman.
Thank you, Chair. Actually, it hinges on member Ratiram's suggestion. I just wanted to inquire into the ministry's policy for addressing or, I guess, contacting parents when students are chronically late, or when you realize students haven't been in class for, I don't know, maybe a week or a few days. What's the policy as pertains to what teachers or the principals should do when that happens?
Chair, I'd like to defer to Ms. Carter, Director of School Supervision and Management.
Good morning once again. So it first starts with the form teacher. So we take attendance, and once we recognize there's a pattern over a month of, 1 day, 2 days, and then we will make contact with the parent. So we have a database, of course, where we have information on every child. And if we recognize, so we might have some students who will come, miss a week, 2 weeks and return, miss a week and 2 return. So they may have intermittent attendance. So we will obviously have parental conferencing with them, and either at the level of the form teacher or the level of the dean, if we find after meeting the form teacher is unable to make contact, then we escalate to the level of the dean. So we would find that we'll have parental conferences where we will find information, whether we collect it and note as to whether or not, what are the reasons why the child cannot come, but then we would look to see whether or not it is, because some schools have benevolent funds, so whether it's a uniform, whether they need transport, and so based on certain needs, we have interaction with benevolent funds, whether it's a uniform or meals. Well, we have school feeding, National School Dietary Services. So we will ensure that, and we have had traction with that, and we ensure that sometimes numbers do reduce and attendance increases. So if that, after that level of interaction, that does not work with the parents, and sometimes we cannot contact the parent. And of course, we know in Trinidad and Tobago, depending on the family circumstances, parents move around a lot, and we may lose contact with them. So this is where we probably do referrals to SSSD, who may actually go to the home. We also have, as I said, community police. If we cannot find, so we interact with them. So at every level and at every stage, we have continuous interactions. If after a year and a month. You know, at times it depends where they may migrate. We have lots of internal migration within Trinidad and also to Tobago. They are classified as a dropout. So it gives us a time of a year and a month to do our interventions, our meetings, collaborating with different persons. We have different agencies, Children's Authority, and those things depending on whatever case we see. And then sometimes the parents then turn up and they give us this whole explanation and they are reintegrated. But in terms of all the specific numbers who we cannot find and who have dropped out, you might find them actually probably working or doing different things to support themselves and their families. But in terms of specifics, most likely it may be for financial reasons, unless we do some other deep dive with other ministries when we can identify them, find them, and get the specifics.
Thank you. Just a follow-up to that. In your submission, you identified that there's a high frequency of males among dropouts. So I understand the reasons that you're giving would apply more to males. But I just wanted to ask about the females, because one of the reasons given for female dropouts was pregnancy. So I wanted to follow up on that. Like, do you have any idea how many girls drop out of school because of pregnancy, and what is the process for them being reinstated in school? And also, if they are below the age of consent, what is the procedure involved in dealing with that?
In terms of the specific data, I might have to defer to a different division who may be collating that data. But in terms of what we do, once they are of age and they show interest to return, and we do reintegrate them, there was a program where student support services would meet with them and treat with their emotional state, so that when they return to school, they recognize, of course, the importance of balancing being a mother and balancing being a student. So we have programs, I think student support services will have that in place, so they are reintegrated. At times, they may be reintegrated in a different school in order to make their reintegration better for their emotional state, because, you know, depending on the type of school, they may not feel comfortable going back to their school. So school supervisors will work with the child and the child's parent, because he may still be a child, and also whether it is, as we say, with the benevolent fund of schools, whether it's financial and SSSD emotional, to ensure that they return. And we've had successes over the years where students do return and they complete their education. And remind me of the other part of the question.
If they are below the age of consent, how is that dealt with?
Well, as the law states, we will have to report to the police, and then they would do their investigations. We also have Children's Authority and the Child Protection Unit, who we would forward those cases once they become known to us. Unfortunately, sometimes they may be a dropout. We have no information whatsoever, and then they return, and then they inform us that the child has given birth. So if we know beforehand, we, of course, will go through the relevant channels and make such reports. And afterwards, of course, we'll do our due diligence with the different units to see whether or not any reports were made.
Thank you. Now, my understanding is that there's an association between truancy dropouts and the underperforming students. So there's a remediation program in place, which I understand is either takes place before school starts or after school is over. But tutor has recommended that this is done during school hours. So my question is, has this been implemented, or are there any challenges to implementing the remediation program during normal school hours?
I'll defer to the PS.
Who will in turn defer to Dr. Smith.
Okay, so Chair, in terms of the remedial program and the additional instruction time, if it were to be explored during the actual school hours, it is going to put some pressure on teachers. And hence, when it was implemented at the primary level, it took place after school hours in some instances, and in a few instances, in a few schools, it took place prior to the start of school, because some of these schools were located in high-risk communities. It was difficult for students to actually be left at school on afternoons. That's the previous remedial program. Currently, we are also looking at another program to assist secondary school students that is being developed at this point in time. Again, to provide them with that additional tuition, especially students who are low performing.
I'm not sure if I quite got what the challenge is for it to be during school hours, especially for the underperforming students at primary school. To me, if they're sitting in class all day and they're not learning, then to give them an hour and 15 minutes after school, I'm not sure would necessarily address their deficiency. So I'm not sure what the issue is with having the remedial sessions during normal school hours for those children, the 11.65% we spoke about, especially since that was recommended by tutor.
Okay, so Chair, what happens when the idea behind the additional or the extra tuition was to increase the number of hours that students who have been exposed to instruction. If you look at what took place at the primary level, it equated, I think, to perhaps 4 or 5 weeks of additional teaching time that these students would have been exposed to. So during the normal school hours, they would receive their instruction. The intention was to bolster that at the end of the day so that it might be a little more targeted in some weak areas that the teacher would have observed. As I said, the challenge there, once in some instances, the availability of the teacher to remain after school. It might also be a case whereby persons, both parents as well as teachers and administrators might find, because my school is located in a high-risk area, I cannot stay back at the end of the school day. So basically what it boiled down to would have been availability of personnel to administer the program. But the intention is not just simply looking at what takes place during school, but providing extra time for these students to be exposed to the curriculum.
Yes, but my understanding is that the participation was poor for the reasons you just outlined. So if there's, for the after school, availability of teachers, but also participation by the students. So the extra time that was envisaged never really materialized.
But, well, Chair, what we saw based on the data that we have collected, for instance, and we have it in the report here, there were 17 schools coming out of those extra tuition, that after school, that really improved significantly. And when we look at the relationship between the attendance and the performance, the schools that had the highest attendance rates for the after school were also the schools that actually show the best improvement in their performance.
Yeah, so that left 63 schools on the other side. Mm-hmm. So that's my point. So the 63 schools that did not improve is the focus of my attention.
Okay. So one of the things that was asked was consistent. So what you may see sometimes, because underperformance is it's an array of individual, parental, community, and even school factors. So that whereas some schools may be able to improve in a year or two, in some instances it might take a little longer in other schools because of the additional dynamics that we have to deal with. But what we would have seen in some instances, even in 63 schools, perhaps you'd have seen an improvement in 1 year, and then a drop in the second year, an improvement. It wasn't consistent. But we did see some movement going forward, but not as consistent as those 17 schools that we identified.
Okay, thank you. Minister Ratiram, did you have one more question? Okay. So, did any of the other members have questions for the panel?
This
on any issue.
Thank you, Chair. I wanted to speak about the cultural transformation policy, and I know that the ministry in its submission did state or make reference to it at page 37. And in speaking to it, reading from your submission, it says the cultural transformation policy inculcates positive values, attitudes, and behaviors, and adjustments to the school curriculum, timetabling, assessment, and student experiences to prioritize not only academic education, but moral, physical, and cultural and arts education, and the development of technical, life, and 21st century skills. Can I ask, first of all, how does the ministry measure the effectiveness of those interventions that promote values, attitudes, and behaviors?
Chair, I'd like to direct our Director Curriculum, Ms. Singh.
The cultural transformation policy was intended to make the schooling experience of students standardized. In that what we noted was that in some schools you had activities happening and in other schools you didn't. So for instance, some schools would have sports day regularly, some schools would do field trips, some schools will have a range of opportunities made available and other schools did not. So that the cultural transformation policy was intended to look at what we call mandatory activities and experiences so that we would promote more equity in the system, and students would therefore have the opportunity to develop from core and extracurricular activities as well as core activities, what we would call cultural capital, or what would be supportive of their learning. The policy, I believe, would have been just about 2 years or so in terms of its genesis. What we were able to record would have been, therefore, across the system, in the areas identified, how many more schools were implementing, for instance, Sports Day as a regular feature of their calendar, participation in, for instance, Days of Peace activities or no violence activities. Those data were collected, and I believe we can provide that in writing. What we also did is, through the training and through support in the area of curriculum implementation, we attempted to have students now demonstrate their learning. We had, for instance, showcase of your your pieces for visual and performing arts. So the schools were intended at least once a year to have a concert, a performance, a display, an exhibition of students' work, science fairs. So what we noticed, and when we were looking at the disparities in experience and the attempt to make sure that our students, whatever school they go to, have similar experiences and therefore be able to inculcate the desired values, attitudes, and behaviors through school culture and a positive school climate. The policy was developed to emphasize that, to emphasize patriotism, and we had projects built around what we call the iconic TNT, where students learned about the icons, not in just people, but practices and even places. So the policy, as I indicated, intended to just pull together the experiences that students should have and make that a standardized practice in all schools.
Can I, sorry, Pierce, I don't know if you were going to.
Yeah, sorry. Could we just allow Dr. Smith to add to?
Okay, so Chair, in addition to the data that we would collect, let's say, for instance, the number of field trips, the director would have also mentioned these activities are designed to impact school climate. And what we do, we actually administer a school climate survey at both the primary level and at the secondary level to both parents, students, as well as teachers. So for instance, a question like this for the parent survey will be, my child feels like they belong at this school. When those activities are held, you get a greater sense of belonging. And we were able to collate, and this is just the parent school climate survey. At the secondary school level, we had 9,937 responses from our students, and parents 3,493, which gives us data on how they view their school. So this allows us to do some measure, give some measures to the impact of the initiatives under the cultural transformation policy.
So, Chair, again through you, there was a, prior to the implementation of the policy itself, of course, across social media, in conversations, there was a repeated call for a return to, I suppose, what from my time and before would have commonly, very correct, Dr. Smith, a return to civics and what is our role as a citizen in a developed society, and have we been able to see the implementation of, outside of the things like the walks for peace and all this, have we been able to see the implementation across schools? And I assume schools were rolling this out on a I suppose as needs basis, because some schools would have had these things in total already operating in a school. And of course, you will also have situations where you had resources, whether that be financial or human resources, impacting that. But have we been able to see those sorts of programs being rolled out? And I suppose, Dr. Smith, if you could continue from it, what is the plan for a continuation of that side of the policy itself?
Thank you very much, Member. Chair, if I can, I think one of the best ways to reflect on the impact, and I guess Ms. Singh would be able to provide some more information, would be the attendance that we would have seen at the National Schools Panorama competition, which in a sense reflects a sort of reinvigoration of the interest in our steel pan going forward. So I don't know if, Chair, if I can ask Ms. Singh to perhaps just elaborate on that initiative.
So the Ministry of Education do provide platforms for students to demonstrate their skills and their commitments and their patriotic feelings, not just at the national level, but even patriotism at the school level. And Dr. Smith refers to one particular platform that we have been supporting over the years, and that would be the National Schools Panorama. And we also have another activity, the Junior Soca Monarch competition. And what we have seen is an incredible increase, not just in participation levels, but the quality of the students' performances have increased. And these are examples, or they attest to the fact that at the school level, we have been cultivating and we have been intentionally providing opportunities to not just gain skills, but to demonstrate it at the school level, and then it translates at the national level. We've also seen, for instance, increased participation in competitions with respect to art. Recently completed our PowerGen competition where over 100 students participated, the quality. So it has been an increased level of participations, not just at events that the ministry mounts, but all stakeholders who provide opportunities. We're talking also at our national sporting events, track and field. We have an increase in our participations in these events. So these are opportunities that demonstrate the students being more, and it's not just engaged, but providing in not in an ad hoc, but in a directed way and in a targeted way experiences. We also note, and I guess, and also we can provide the information, the community-based involvement of our students through projects, through volunteerism. So those are examples we can provide, and you will see under the cultural transformation policy, a support policy for patriotism, as we have identified, and we already have in our curricula content areas of learning that support civic mindedness, and we have provided under the policy the lens to amplify these curriculum and to direct focus. So as I indicate, it is not that the system in isolated pockets did not have examples of these experiences or opportunities. We know in our system that it was varied. What the policy intended to do was to be more intentional, and rather than leave it to ad hoc interest, to provide a mandate.
I've been given permission by the chair begrudgingly to ask two very short questions. So if I could ask, the question will be short and I hope the answer will be short. One is whether teachers receive specialized training for it. And then the second question is, are there plans to strengthen the policy's implementation in those schools that may have been impacted in terms of its rollout?
Yes. So in the first instance and the first phase, principals were engaged. They were engaged in terms of sessions where they were provided documents, resources, and guidelines in terms of the interpreting the policy and the practices into schools. We also train teachers. I can specifically speak to the project-based learning built around the patriotism policy and iconic Trinidad and Tobago. National training took place and it continues. So same for problem-based learning, national training, and currently we are just finishing a year level of training of teachers for that. And we've also continued our training on the arts, the drama. We continue with that. So the policy has allowed us to interact with teachers in specific areas to support beyond just the general curriculum in terms of extracting critical products of learning. We do not, the training is therefore different in that we are not looking at the teachers' instruction in terms of they are being more effective in teaching, but we are guiding the instruction to having evidence of that in the spaces of the school, and then ultimately to have it demonstrated at national level. Best Village, Sandfest, those are the fora we want to see increased participation as well as quality.
Thank you for that. Could I ask the ministry to please provide a comprehensive update in writing outlining which schools have dedicated music rooms and teachers and musical instruments as a follow-up to that? Because I think there's a deficiency in that area. And we have one final question, a very brief question from Minister Ratiram, and then we will wrap up.
Thank you most kindly, Madam Chair. And I just want to quickly mention to PS and the team that while we look at the cultural transformation policy and the adjustment in the school curriculum to prioritize not only academic education, but moral, physical, cultural, and arts, an area that I have not heard or didn't see anywhere in the report is agriculture. And what we recognize is that agriculture has been significantly declining in our schools with limited staff from the information that I would have been receiving out there in terms of the resources, etc., into the agricultural sector. And we've seen that being translated into the wider arena where our contribution from agriculture to GDP over the last 10 years have declined significantly from 1.4 billion to somewhere around 650 million. More than 50% of our agriculture sector has been lost over the last decade. And it is something that we really need to inculcate into the culture and into the learning process so we can definitely have more young persons exposed to the field of agriculture and the importance of food security and healthy organic eating habits. So it's something that, I want to invite PS to liaise with PS in the Ministry of Agriculture, and we can collaborate and putting forward, some support to help the Ministry of Education in enhancing and taking part of our extension training and information services programs. So we have over 30 different programs within the ministry that we can help the Ministry of Education with some of those.
Minister, offer noted and accepted. Thank you.
Thank you.
Okay, excellent. Well, thanks everybody. I just want to invite probably brief closing comments from any of the officials present before we adjourn.
Thank you, Chair. I shall be particularly brief, simply to say thank you to you and the members for the questions posed to the ministry today. I thought it allowed us to elaborate and clarify many of the items presented in our report, and even to, force us to think further in some of the ways in which we could improve in what we are doing. I think we have benefited from it, so that when we go back to shop, there is homework to be done. We do undertake to provide the written responses as requested. So thank you very much.
Okay, I just want to say thank you to all the officials of the Ministry of Education for your contributions to today's proceedings, and to the committee members for your support and participation, and of course to the staff of the Office of the Parliament for your procedural and logistical support, and to the viewing and listening audience. The meeting is now adjourned. Thank you.